You are welcome to, once again, my YouTube handle. Today we are discussing, as a continuation in our series of discussion on logistics management systems in the health sector. And you remember we have taken part 1 to part 5. This is the concluding part. And the title is Equipment Disposal, Procedures, Standards, and Conclusion. But before we talk about the part 6, just a reminder, in the part 5, we could summarize it as in what we learned in part 5, that MOUs and legal documentation, they define responsibilities, they build trust, and ensure accountability between partners. We also learned that routine maintenance keeps equipment functional through cleaning, calibration, and regular inspection. We also learned that planned preventive maintenance, what you know as the PPM, does anticipates problems and prevents failures through scheduled documented servicing. Together, this builds a sustainable logistic ecosystem that supports efficient healthcare delivery. If you haven't watched it, please, you can check my YouTube page and you will see part 1 to part 5. Today, we continue with part 6. Welcome back, everyone, to the final lecture in our series on logistic management system in the health sector. Once again, my name is Dr. Henry Aisabonye, and today we'll be discussing the last phase in the equipment management cycle, known as equipment disposal, and how proper disposal practices align with public health, environmental safety, and legal standards. We will also conclude with key takeaways, and your time paper exercises for this course will be discussed. Yes, you have a term paper so that you can, as a public health professional in the making, as a logistic manager in the making, you need to do these exercises so that it can help you get a good grasp of all that you have learned and put them to actual application. So, in part 6, we'll be talking about equipment disposal and factors, procedure for equipment disposal, and equipment disposal. So these are what we'll be looking at under equipment disposal. In healthcare logistics, equipment disposal refers to the process of removing or decommissioning obsolete, damaged, or expired equipment in a safe, responsible, and compliant manner. Not just throwing it away anyhow. There is a procedure. Many people focus on procurement and maintenance, but the end of an equipment's life is actually just as important as its beginning. So let's examine the key factors that influence disposal decisions. Number 1, obsolescence. The obsolescence simply tells us that equipment finally becomes outdated. So, obsolescence happens when equipment becomes outdated. Every equipment, no matter how beautiful, no matter how useful, no matter how valid it is, it will certainly become outdated, either due to new technology or reduced functionality. For example, old laboratory analyzers that can't interface with digital data systems may no longer need to be on the shelf anymore, and they may no longer meet modern standards anymore because it cannot interface with digital era, with digital data systems. You can't plug it to a laptop, you can't plug it to a PC, you can't apply it. So in the modern times, you no longer write results by hand. Results are now electronic. And so if you have a system that can no longer interface or cannot interface with the system, it's obsolete. When such equipment consumes resources but contributes little to service delivery, that's disposal becomes necessary. You have an equipment, it's consuming a lot of resources, but it's giving back a little. Taking up a lot of reagents, costly, but it's doing less analysis. So there's a need to dispose it. So what are the other factors that influence disposal? Number 2, repair cost comparison. Repair cost comparison. Sometimes repairing an old piece of equipment costs more than purchasing a new one. A sound logistics system uses cost-benefit analysis to decide whether to repair, repurpose, or dispose of the asset. Always remember, maintenance is good, but not at any cost. Maintenance is good, but not at any cost. So a sound logistics system uses cost-benefit analysis, and it has to decide whether to repair, repurpose, or dispose of the asset. Number 3, regulatory compliance. Health equipment disposal must comply with national and international safety standards to prevent environmental pollution and protect workers handling biomedical waste. Non-compliance can attract heavy penalties or even legal actions, and that will be too expensive. So it is important that our equipment disposal comply with adequate safety standards. And so let's look at it this way. Disposal isn't just a technical issue, no. It's also an ethical and legal responsibility. As a case study, there are some hospitals following WHO's biomedical waste management guidelines. And you would find out that some of them don't even know these guidelines. Why the few who know these guidelines, some don't even follow it. And so those hospitals who follow these biomedical waste management guidelines successfully establish safe disposal systems for expired reagents and damaged diagnostic equipment. And this prevented environmental contamination, and it improved their facilities' audit ratings. Such examples show that good disposal practice is not just about getting rid of waste. It's about protecting people and the planet. We'll move to the next slide. Procedure for equipment disposal. Procedure for equipment disposal. So let's take it one by one. Let's discuss the step-by-step process for proper disposal. A structured approach ensures accountability, safety, and compliance. So you must have that structured approach as a standard operating procedure. Step 1 is assessment. First, assess the equipment's condition and determine whether it is still functional. Determine if it is still repairable or it is beyond use. That's the first thing you do when you are assessing. Check the equipment condition, whether it is still functional, whether it is repairable, or it is beyond use. And at this stage, you may involve technical evaluation reports or board inspection to determine residual value. See what is remaining of it, or what value is it. Step number 2, decontamination. Before disposal, all medical and laboratory devices must be safely cleaned and disinfected to remove biological hazards. This prevents infection transmission to handlers or the environment. So you must ensure that all the devices you want to decontaminate, you must first of all ensure that they are safely cleaned and disinfected. Remove all the biological hazards that could be dangerous out there. And that way you protect the environment. Number 3, you then carry out final disposal. Finally, partner with certified recycling firms or waste management contractors who follow environmental safety regulations. You know them, you have them. Like in Lagos, they call them a farmer. Other states call it different names, but some call it LOMA, Lagos Waste Management Agency, and all that. So you have a lot of them. They understand the safety regulations. They are certified by the government. You can collaborate with them. Some components like metal parts or circuit boards can be recycled, oh yes, while hazardous materials are neutralized under controlled conditions. Let's look at this example. A hospital collaborated with a local recycling firm to separate usable components from old radiology machines. They recovered valuable metal parts, and that way they reduced landfill waste and they generated small revenue. That's smart. That's a sustainable logistics in action. And so, for every waste, there is still something that we can recycle. And it can also yield some little income because it is needed somewhere else as a raw material. So let's see the next slide. Standards for equipment disposal. Standards for equipment disposal. Proper disposal must adhere to both international frameworks and local regulations. So let's review some of the key standards that you should know as a health logistics manager in the making, or you're already a logistics manager or public health expert. Number one is the WHO standard. The WHO standard. The World Health Organization provides frameworks for safe biomedical waste management, including segregation, collection, treatment, and final disposal of health-related waste. Following this ensures global best practice, and it protects staff and the environment. And our environment is very important. That's where you and I live in, so we must protect it by every means. Number two is the ISO certifications. The International Organization for Standardization, outlines environmental and quality management standards, particularly the ISO 14001 for environmental responsibility. That of the laboratory is 15189. And so many others, you have the 19001 and so on. So facilities that comply with ISO standards demonstrate professionalism and accountability. Number three, we look at local regulations. For example, in Nigeria, every country has its own disposal laws. In Nigeria, we have the Nigerian National Environmental Sanitation Waste Control Regulation of 2009. We also have the Biomedical Waste Management Rules of 2016. These are laws, regulations. In other jurisdictions, provide the legal foundation for safe handling and disposal of medical equipment. In your country, what is the legal foundation? What are the jurisdictions? What are the laws? In Nigeria, we have the Nigerian National Environmental Sanitation and Waste Control Regulation 2009. We have the Biomedical Waste Management Rules 2016. Now, compliance with these national laws prevents penalties and enhances institutional credibility. As an emphasis, ethical disposal is not a choice. It is a duty for all. Improper disposal can lead to environmental pollution, legal consequences, and reputational damage to healthcare institutions. You are advised to always follow due process and document every step you take when carrying out any disposal process. We move to the last slide under this topic, the conclusion. So now let's bring it all together. Throughout this course, from part 1 to part 6, we have journeyed through the entire logistics management cycle, from planning and procurement to storage, maintenance, and now disposal. So here's what I want you to remember. Remember this: efficient logistics saves time, money, and lives. Standardization and documentation protect systems from collapsing. Training, accountability, and compliance, they all sustain health delivery long after the initial investment. By adopting these best practices and leveraging technology, we can build stronger, smarter, and safer health logistics systems across Africa and beyond. As a final word on this interesting discussion, I'd like to say that as future health policy leaders and managers, your role is not just to run systems, but to reimagine them. And each decision you make in logistics, whether it is procurement, inventory, maintenance, or disposal, it directly affects patient outcomes. Always remember that. So always think strategically, always think ethically, and always think sustainably. Remember that public health logistics is not about moving commodities. It's about moving lives forward. For those of you who will be interested in carrying out this continuous assessment, although for my student it is compulsory, because that's how I'm going to evaluate what you have learned in the course of part 1 to part 6. So it's very compulsory for my student. But for you watching online, no problem. You can just, read it and probably do 1 or 2 things with it just to help you, learn. So we are looking at the following. So this is what you are going to do for your term paper. You carry out a case study analysis. A case study analysis. Remember, you are recommended to do this exercise and term paper for this course. Don't forget that. Now, these are the term paper guidelines. Number 1, this is the topic: develop a framework for preventive maintenance and disposal of health equipment in a tertiary hospital. Develop a framework for preventive maintenance and disposal of equipment in a tertiary hospital using what I have taught you on this part 1 to part 6. Do not use just the artificial intelligence or ChatGPT. Whatever is not here, I may not accept it. So please, first of all, work on what you have been taught, and then you can add to it as an addendum. Number 2, ensure that the length is 10 pages minimum. That's content only, not reference. Content only minus reference, 10 page. Spacing is 1.5. Your font is Times New Roman. Your referencing style is Vancouver. And you must include a Turnitin report with no plagiarism. This is very, very important. So, the continuous assessment task is this. The continuous assessment task is this. Review a global example of logistics failure. For instance, vaccine cold chain collapse during a crisis. Identify what went wrong and suggest practical solutions. So those are the continuous assessment tests. Number 1, a case study analysis. And number 2 is a research project that you write, a term paper. Design a preventive maintenance schedule tailored to a Nigerian teaching hospital, including reporting formats and documentation flow. So these exercises will help you apply classroom knowledge to the real-world public health logistics system. So this is what I expect from you. A case study analysis, review, and present on global examples of human logistics failures, outlining lessons learned and solutions adopted. Number 2, research project, develop a comprehensive framework for preventive maintenance tailored to a tertiary hospital setting. All right. If you enjoyed this video, you can also go ahead, like the video, subscribe, share it with your friends. I'll see you in subsequent videos when they are published. I want to appreciate you for taking time to listen, and I'm sure you enjoyed it. And I wish you all the best in all your endeavors. Thank you. Once again, my name is Dr. Isagboyin Henry. Thank you for watching. Thank you. Bye.